Well, good evening, everybody, and welcome to another edition of Ask the Doctor. Tonight we are going to be talking about heart health and functional medicine. We are lucky once again to have an amazing teacher and mentor with us. He has been in clinical practice 31 years, family man, teaches, trains, and lectures doctors all over the world, so we're super blessed to have him teach us. Please put your questions in the chat so we can answer them at the end. Without any further ado, the amazing Dr. Bob.
Well, Carol, thank you always. Yeah, today is super appropriate for that wonderful heart. I don't even know what we call it, right? I mean, it's a symbol, I guess, not anything other than that. It's beautiful. It's heartfelt. Life is good. And thank you always for your beautiful friendship, wonderful introduction, and monitoring the chat and all the things that you do. So yes, I've been in clinical practice now. This is my 31st year. I've seen some pretty amazing heart cases, and I'll share a couple of videos of that. A couple of people that were basically on transplant lists with full recoveries and, in pretty amazing time and fashion as well. And I've seen both ends of the spectrum. I've seen people sent home to die, and I've seen world champion athletes. And I have an absolute passion for training doctors. So I've done that 10,000 hours worth on 6 different continents. We start looking at cardiovascular deaths. And you know what, it's still going to be the top killer in the US. But the great news is we've made some pretty significant progress. And I'll show you the data. And no surprise, I would think, if you're on this Zoom, that you'll realize that lifestyle choices, functional medicine are the biggest difference. And even a 2022 article, in fact, it came out February 22, 2022, 2/22/22, fun date for it, really highlights lifestyle as being the key to longevity, and especially cardiovascular longevity. But I'll turn back our clock. Archives of Internal Medicine, this was 1989. These are all risk factors for high blood pressure. They said if you were obese, if you had high blood pressure, prediabetes or diabetes, and unhealthy blood lipids, you were going to have a problem and you were going to die early, and probably from cardiovascular disease. But the good news is they're beginning to realize that you don't become obese automatically. You don't develop diabetes automatically. You don't develop high triglycerides or cholesterol automatically, or you don't get high blood pressure automatically. You earn it, and you earn it with stress, toxins, malnutrition, physical inactivity. And we'll show you the data on that. But first, let's talk about how cardiovascular disease can lead to sudden cardiac death. And you'll begin to realize that there's a whole lot more to it than just cholesterol and other things. So I'm going to play this wonderful education video for you.
Atherosclerosis, or hardening of the arteries, is the cause of death for 50% of our population. In fact, 80% of us will eventually suffer from some manifestation of atherosclerosis. Heart attack, stroke, blocked leg arteries, and a host of other problems are all caused by this disorder. Most of us have been led to believe that atherosclerosis is simply the result of high cholesterol, which then deposits on the inside of the arteries. There is actually much more to atherosclerosis than simply high cholesterol. In actual fact, atherosclerosis is a complex process caused primarily by free radical damage. The artery is lined by a leak-proof layer designed to prevent cholesterol or other foreign material from invading the deeper layers of the artery wall. If this leak-proof lining is damaged by free radicals, cholesterol, calcium, iron, and other toxic substances can begin to invade the arterial wall, which causes a further increase in free radical damage. White blood cells then gather in and around this area of damage and cause inflammation in the wall of the artery. Eventually, the inflamed artery wall becomes thickened with scar tissue, cholesterol, calcium, and iron. This thickened region is now called a plaque. If the plaque becomes thick enough, blood flow through the artery is impaired. This blockage of blood flow can lead to chest pain, known as angina, or pain in the legs with walking, known as claudication. In addition to causing stable blockages, the plaque can become dangerously unstable. Without warning, the brittle and unstable plaque may rupture, leading to sudden clot formation. This is how unexpected heart attacks often occur. This microscopic picture is a cross-section through an actual coronary artery in a region of the heart where plaque rupture caused sudden cardiac death. This area, which was the opening where blood flowed, is now completely blocked with a large clot. Around the outside of the clot are small bits of calcium, which was part of the calcified and unstable plaque. Prior to its rupture, this plaque was only blocking the artery by about 50%. This would not have been enough of a blockage to cause any symptoms at all. One day, without warning, the plaque suddenly ruptured. Its contents spilled out through this opening, and the plaque's calcified shell exploded against the side of the artery. The debris from the inside of the plaque stimulated this large clot to form. This person was probably well and without any symptoms such as angina, until suddenly this small plaque ruptured, leading to death within minutes. If this same phenomena occurred to a plaque in the neck arteries, a piece of the plaque would likely travel into the brain, lodging there and causing a stroke. Completely blocked with a large clot.
Very informative. And I like to stop here because even though there was a plaquing, notice there was still plenty of area for blood flow. And what we also know, by the way, is plaquing occurs gradually. That rupture is sudden, and that can be problematic. And by the way, if you control inflammation, control blood sugar, and have a good supply of nitric oxide, that stabilizes the plaque. But we also know that bodies build their own collateral circulation around different things. So if we're going to look at the true deadly quartet, it'd be stress, toxins, malnutrition, physical inactivity. And this is the journal Circulation article from February 22, 2022. And they were calling it Life's Simple 7 related to cardiovascular disease. Number one is going to be diet. And notice what they show. Fish, and we'll talk a little bit later about fish oils, but fish oils or omega-3s prevent heart attack, stroke, cancer by 13 different mechanisms. Then what do they have? Fruits and vegetables. So pretty good choices. If God made it, it's okay. If man made it, stay away. The next thing they're going to say is weight management. Don't get that big belly, especially visceral fat. That tends to be more dangerous than other types of fat. Exercise very, very consistently. And people will ask me, what's the best form of exercise? Hey, the one that you'll do consistently, the one that you like. If you want to get fit fast, it'd be high intensity intervals. But you know what? If you like ballroom dancing, that's a phenomenal way to stay fit. If you like tennis, same kind of thing. If you like hiking, just do what you like to do consistently. And then I'm going to go to the next four. Don't smoke. That is possibly the top risk factor for cardiovascular of all time. And I'll show you the data. It's actually shocking how cigarette smoke correlates with cardiovascular death. You want to keep blood pressure under control. We'll show the link between stress and that. We could talk a little bit about obesity as well, but if you gain weight, you need to have more vasculature to supply the new tissue, and that puts a strain on the heart. You want to have your cholesterol levels in good range. I find it wonderful that they're not talking about drugs there. It's really lifestyle choices and blood glucose as well. And this is a good strategy. We could call these magnificent 7 strategies. So if we go to the deaths from heart disease US, and by the way, it's going to be different in undeveloped countries. Developed countries are known for cardiovascular disease. You'll see 1900, this is death rate per 100,000. So about 150 per 100,000. That's not much at all. 1,000 per 100,000 would be 1%. So we've got 150 per 100,000, and then see that starts climbing. But per 100,000 population, sorry, that might not be 100,000 deaths. So let me clarify that. But then suddenly we see a decline, and that decline is continued to modern days. So I'll go forward 2000 on down. It seems like we're flattening the curve a little bit. You probably heard that before. But overall, cardiovascular disease has been on decline for a period of time. Now, this is a graph that talks about the rise of cigarette smoking. And so notice that there wasn't much of it going on around 1900, then a rise until about the first Surgeon General's report. And then there's been a consistent decline. Now, since I'm a graph guy, I'm actually going to superimpose a couple different graphs. So I'm going to match up the timelines, 1900, 1900, 1998, roughly 1998. And I drew a best fit curve over that, something that I could transpose, and look at how these things match so closely. And, you know, if you look at someone who's died early from cardiovascular disease, probably a really good chance that they were a smoker. And so I always tell people, if you smoke, quit. In fact, that's the first conversation we're going to have. If you smoke, quit. Now, I know that's easier said than done. So, you know, let's say I have a 4-pack a day smoker and I say I can't do it. I'll ask, okay, you know, can you cut back 1 cigarette this week? Just 1 cigarette a day. So instead of 80 a day, can you have 79 a day? And they say, well, I can do that. Well, then how about next week you do 78? And then the week after that, 77. And they see that they can do that. Well, I'll tell you what happens 80 weeks later, you're down to 0. But what if they can't quit? Well, I'll tell you what, if they're only doing 1, 2, or 3 cigarettes a day, that's much better than 80 a day. And that's easier to create lifestyle choices and antioxidant strategies that can, you know, combat a few bad choices, but consistent bad choices will kill you. So now let's look at refined sugar. So, you know, it used to be very, very rare. You'd almost pay a king's ransom for it. And then look how it ramped up over the last couple of centuries, very, very extremely, as they started mass farming sugarcane and figuring out how to process the sugar. So understand, and I'll share the exact language from this article and this graphic: increased plasma glucose, that's approaching diabetes, prediabetes, contribute to cardiovascular risk by activating multiple, here they're calling it atherogenic mechanisms. And by the way, it's even worse than that. You're not just going to get atherosclerosis, you're going to be constantly inflamed, and you're going to contribute to a shorter life. It's just that simple. People who have the best blood sugar regulation live the longest. Pretty powerful study on that. By the time they get to, you know, just a plasma glucose of maybe 110 or a hemoglobin A1C of 6.0, 28% increased risk of death from all causes. Friends do not let friends become diabetic. Friends do not let friends become fat. And in a perfect world, friends don't let friends live on really bad choices. Now, an occasional treat, why not go with a better bad choice? Why not go with an organic, you know, grain-free or flour-free chocolate cake? That would be a better bad choice. Now we start looking at the standard American diet, the SAD diet. This was right in Archives of Internal Medicine, that deadly quartet. It says that the deadly quartet, big belly, high blood pressure, high blood lipids, high blood insulin, blood sugar, strongly associated with consumption of processed foods. And that's what they say, unrestricted, right? They should probably, I don't know, find a way to restrict it. You know, you can only have 1 a month or something like that. Now, we start looking at physical inactivity, and pretty clear that physical activity is protective for a lot of different things. It protects your brain, it protects your body, it's good for your immune system. But the people that were most fit, dramatic decline in death rate, especially as it relates to cardiovascular disease. Then we have stress to wind out the deadly quartet. Pretty powerful correlation, how stress damages the heart. And so they're talking about things almost like a post-traumatic stress disorder. So how much does heart attack go up? 134%, stroke 175%, high blood pressure 215%. So you start looking at that, and what do? Well, I'm a big fan of that stress reset, melatonin, theanine, Ganoderma spores every waking hour. New guidelines on aspirin. So now keep in mind that this is an independent group. It's the U.S. Preventive Services Task Force. So these are not government-appointed people, nor are they directed by the drug companies. It's made up of 6 volunteers, and you can go to their website. I put it there. And they are nationally recognized experts in prevention, evidence-based medicine, what really works, and primary care. And so quite simply, here's what they say. is that, you know what, you probably shouldn't do it. So people who are 40 to 59, when they're looking at cardiovascular risk, here's what it says. The decision to initiate low dose aspirin use for primary prevention of cardiovascular disease in adults 40 to 59 who have 10% or greater 10-year risk should be individual. Evidence indicates that the net benefit of aspirin use in this group is small, very small. I got to go back to that previous one. I'll show you Harvard's data. Persons who are not at increased risk for bleeding and are willing to take low dose aspirin are more likely to benefit. So that bleeding risk is very, very important. And notice after the age of 60, recommends against initiating low dose aspirin therapy for primary prevention in people over 60, who's going to be the vast majority of people there. So now we're going to go to Harvard's data, Harvard Health. And here's what it said. It makes the most sense to take aspirin if your chance of having a heart attack or stroke is greater than the odds of the aspirin causing a problem. So when you start talking about GI, gastrointestinal bleeding, gut bleeding, or a hemorrhagic stroke, your brain bleeding out. So if you're a 70 to 79-year-old male, there's a 1 in 27 chance of GI bleeding or hemorrhagic stroke. Woman, slightly less. So you want to weigh that risk against it. And again, this group of experts says after 60, we're not going to recommend it. So when we start looking at bleeding risk, this is a hand that was bleeding, from a simple bump. Now, I'm glad it was her hand and not her head, because if it was her head, maybe she'd bleed out. But this was a follow-up of patients that were prescribed warfarin, which is also known as Coumadin, which, by the way, is sold as rat poison, aspirin, or the other one is Plavix after discharge. What they found was that about 1 in 9 people, 11.4%, so a little better than 1 in 9, experienced non-fatal or even fatal bleeding. So you want to be careful with these blood thinners. And I always say we want to look at this thing called prothrombin time with international normalized ratio. So we'll talk about comprehensive cardiac nutrition before we finish. But while we're talking about bleeding, here's what we know. Ganoderma, here's what this says, provided significant inhibition of thrombotic death. That means a blood clot causing death or paralysis at a dose of 60 micrograms per kilogram. Now, this was a study where they actually gave rats, they wouldn't do this to humans, a clotting agent called chinic acid. And they said, okay, Ganoderma does it at 60 micrograms per kilogram, 60 millionths of a gram per 2.2 pounds body weight, whereas aspirin required 10 to 20 milligrams per kilogram of body weight. So Ganoderma is known to prevent abnormal clotting without promoting abnormal bleeding. Where we start looking at the drugs, they prevent normal clotting and promote abnormal bleeding, and 1 in 9 have a serious bleeding issue. So if we were to take my body weight, I could have 2 cups a day of Ganoderma infused black coffee, or I could have 9 baby aspirin a day. Keep in mind, at 1 baby aspirin a day, the risk of bleeding would exceed my cardiac risk. So how about 9 a day? Risky, right? So why not go with the healthier choice? So some people will say, wait a minute, my doctor tells me I have a heart problem, I shouldn't drink coffee. So here's the data, here's the PubMed ID, and I won't read too much to you, but this one I will. Here's what it says. Habitual coffee consumption is also associated with lower risk for cardiovascular death and a variety of adverse cardiovascular outcomes, including coronary heart disease, congestive heart failure, and stroke. Coffee's effects on arrhythmias, meaning abnormal heart rhythm, and hypertension are neutral. So coffee does not cause abnormal rhythm. It does not cause hypertension. And here's part of the issue with that. Once people drink it consistently, if someone never has a cup of coffee and they drink a cup, well, they're going to get a push to their adrenal glands and maybe an elevated heart rate. But even at 1 cup a day, by the time they're 5 days in, 5 straight days of 1 cup a day, that effect is reduced by 90%. That's in the medical literature. So keep in mind, if you're doing 3.3 cups a day, every day, like most people, then it goes away. So notice this, coffee consumption is associated with improvements in some cardiovascular risk factors, including type 2 diabetes. That's one of the deadly quartet. Depression, why is that a problem? Because people make bad food choices. They self-medicate with sugar and probably trans fats, and obesity, and that's a major risk factor. I like this term, chronic coffee consumption. That means more than 6 months. Also appears to protect against some neurodegenerative diseases like Parkinson's disease, is associated with improved asthma control, and lowers the risk for liver disease and cancer. Habitual intake of 3 to 4 cups of coffee each day appears to be safe and is associated with the most robust benefits. So there you have it. So what if you had coffee and then you had Ganoderma? Wouldn't that be an amazing combination for you? So I'm going to share the case of Ron Worley, and what a fun video. So here it is.
Hey guys, Ron Worley here. I'm going to tell you a little story. I happen to be at an open house right now and nobody's here. I'm out in the middle of nowhere. It's sort of boring. So what a better time to talk to you about some friends of mine and what they did for me. In order to do that, I need to back up and tell you what happened to me. So 3 years ago on August 16th, I was standing there talking and doing a seminar for a group of professionals, and I dropped dead. And I actually died twice on the floor there. The first time my wife tried to help me with some CPR and bring me back to life. That wasn't working. Thank God we had some professionals that had AED machines, and they hooked those up and brought me back to life. I had sudden cardiac arrest. Now, mind you, I was an ex-bodybuilder at the time. I ate right. I did everything right. My heart was not unhealthy. Just for some reason, it wasn't pumping enough blood into my body. What it's supposed to do is pump 65% of the body's blood from the left side, left ventricle. Mine was only pumping 10. And only 2% of the people that have this problem actually survive the problem. So I was a lucky 2%er. That being said, I told that entire story to Deanna when I met her. Just by chance, she happened to come over and do an open house with her and Casey at my wife and I's house. And we just started rapping away there, and she was so inviting and welcome and warming, and she believes so hard in these products of hers, and a man named Dr. Bob. She tells me all about this and invites us to come meet Dr. Bob. And you know, over the 3 years, I've tried absolutely everything. Everybody's products. I've done stem cell. I've done, and I'm on the cardiologist's pills. Nothing has fixed me over the 3 years. Right now, or before this, when I met her, I was really just treating the symptoms of heart failure with lots of medication that made me ill and feel worse, really. So I meet with Dr. Bob, and what a fantastic guy. He was super outgoing and funny, and he really was passionate about what he was doing. And so I listened to him talk, and while he's talking, he pops up a few videos, and lo and behold, there's 3 people that have the same exact thing I have, and he had managed to fix them. Now, he'll tell you he can't make claims, and he would not tell me he was going to fix me. He said he would like to. He said maybe. And so you know what? I just trusted him, and we went for it. He gave me a 10-day protocol to try. We did some testing before and after. And within those 10 days, there's some specific markers for heart failure that we look at to see if you're getting better. And all the markers went up, changed for the better. Some of them even changed to a point where I was healthier than an actual healthy heart at my age. Case in point, I had 13,000 PVCs a day before meeting Dr. Bob. 13,000 PVCs means 13,000 negative heartbeats. And every time that happens, I get lightheaded, faint, I want to puke, and it really just disrupts my day, and it's all day long. And by the time 3 o'clock rolls around, I'm exhausted from having these episodes all day long. So it was quite annoying, and it took away from my day. I couldn't work out or any of that. Went and saw the doctor after the 10 days, and I'm having less than 800. 800 is the magic number that if you are a healthy person, they look for that number and see if it's an 800 or below, you're actually you're sitting pretty good. That's a healthy heart. Another one of the big markers was the size. I had stretched out into the 7s. A month prior, I was at a 6.5 on my heart, and I had shrunk down to a 6. which is a huge number because it took me 3 years to drop just a quarter centimeter. And within 10 days, Dr. Bob had me shrunk a half a centimeter. This is a huge number for us. To see some productivity in such a short time was remarkable. And actually for me, I instantly felt after that 10 days was up, I instantly felt better. No longer was I having the chest burn. I didn't feel like my heart was underwater or that I couldn't breathe. I was able to go back to working out again. And I can't even tell you guys, if I saw these when I was sitting in the room just like you, and I didn't believe that it could work for me. I'm telling you, listen to these people. It will work for you. It is not BS. They're not just trying to make money on you. This is a sincere effort to give you some help.
So very, very interesting on that. So I was doing an event in Colorado. So notice he said, 3 years ago, 2016. So it was 2019 that I did that. And so, Ron was invited to come meet me. And, I greeted him. I was introduced directly to him, or he was introduced to me. And I said, well, happy, beautiful day. How can I help you? And he said, well, you can't. And I said, okay, what's up with you? He says, well, I'm in congestive heart failure. I've got 10% ejection fraction. Listen, there's only a 2% probability I'd even stand here and even be able to talk to you. Sorry, but I've seen everybody, I've done everything. Well, guess what? He didn't see everything and do everything, because on that 10-day protocol, which we'll share that with you, we made an absolutely epic difference for Ron. And I don't know, I guess I don't have a video of that. I have to find it on another computer, but that was one that I shared. So this happened to be Betty Deloche, and I filmed her in my office. Maybe it's on my YouTube channel, but she was on cardiac transplant list. And, just a weird circumstance. Now, literally at age 70, she's got 60% ejection fraction. And I filmed her on the day that she was in my office, which was fun because her husband had asked her, what would you like for our 50th anniversary? And she said, well, sweetheart, I want you to see Dr. Bob. And he was actually an emergency room physician and making the world better, with his talents, but not taking as good a care of himself. So when we start looking at comprehensive cardiac nutrition, coenzyme Q10, I find this fascinating. It says it's the first drug to improve heart failure mortality in over a decade. It's certainly not a drug, it's a nutrient. Coenzyme Q10, very, very powerful there. Combination of taurine and magnesium is really important to regulate arrhythmia. Omega-3s, the better your omega-3 status, the least likely you are to have a cardiac problem. And when someone has arrhythmia, the combination of melatonin and omega-3 work together. So that was just one of those amazing things that we did a stress reset with melatonin, theanine, spores, also gave the omega-3, and we actually gave resolving form of omega-3. And when you start looking at 13,000 PVCs per day, that might seem like a lot. But keep in mind, if your heart beats 72 beats a minute, 60 minutes an hour, 24 hours a day, that's in the neighborhood of 100,000 beats a day. So what's 800? Less than 1%, less than 1 in 100 irregular beats. And that's fine by any cardiologist. So this was the protocol that we had put together for Ron. We used, functional food shakes, D3, K2, taurine, melatonin, theanine. I call them activated omega-3s. So that's the resolving form, Ganoderma spores, coenzyme Q10, and we also did a time release lipoic acid based on some other data that we had seen with him. And by the way, omega-3s prevent heart attack, stroke, and cancer by 13 different mechanisms. And it calls out the resolvins from the activated form of omega-3s. And keep in mind that GABA can be something that can prevent heart arrhythmia. Theanine facilitates GABA, Ganoderma facilitates GABA. And that's part of why we use those in our stress reset. And also it's very, again, very, very good for arrhythmia. Someone asked me, come on, is there more evidence? There's tons of evidence, 76 studies on Ganoderma and cardiovascular disease. And notice over the last handful of years, even more. And someone even asked about cordyceps earlier today. This is my second Zoom. 57 studies there. So we have a red tea that has Ganoderma and cordyceps in it. And now that will lead us to questions and answers if you have any.
Perfect. Well, we do have 2 questions in the chat so far, so I'm sure more will come in now. So let's get started. I know you would probably need more information, but if a person who is taking metformin, Coumadin, glipizide, and other prescriptions is having heart palpitations, would you have any opinion on what that might be causing them? Also, she enjoys King coffee. Would you suggest more frequent use of the products?
All right, so let's look at what she's taking. So the metformin and the glipizide are diabetic medications. So we want to look and see how well controlled the blood sugar is. And keep in mind, insulin resistance, prediabetes, or even full-blown diabetes, at least 5 pro-inflammatory mechanisms. Inflammation devours nitric oxide. We didn't talk about that, but nitric oxide is what dilates blood vessels, and you need good oxygen delivery to the heart to have ideal delivery. And then the Coumadin is an anti-clotting agent, so that could be for some type of arrhythmia or something else. But so do I have an answer what's causing it? Sure, they need to essentially eat right, drink right, think right, move right, sleep right, poop right, talk right every day. So what's eat right? Certainly a low glycemic index, ketogenic, anti-inflammatory diet. What's drink right? Well, good start with reishi or Ganoderma infused King of Coffee, which by the way, just won an award and that'll be published soon, but a global award on the most innovative coffee product in the world. So that award was just given by an independent agency. This stuff is really, really, really good. And by the way, we have a red tea that has cordyceps and Ganoderma within it. Think right, manage the stress. That's the stress reset. Melatonin, theanine, Ganoderma, spores. Move right. So you want to exercise every single day, but if you have heart arrhythmia, you got to be pretty doggone gentle with yourself, right? Because we don't want you having a major issue there. So things like yoga, stretching, move right, sleep right, 8 hours a night. Poop right, that's detoxify. There's, certainly want to do that. And keep in mind, Elvis supposedly died on the toilet because he was constipated and he pushed too hard. He increased his pressure, and you will increase intracranial pressure. And apparently he stroked out by being constipated. So poop right, gentle, good fiber, good water, good neurologic tone, and talk right. That's going to be the conversation you have with yourself. Might as well include everybody around you as well, but also your cell-to-cell communication. And you got to do all those things. And so, if you just screenshot that protocol that I put for Ron Worley, are those safe? Every one of those things are safe. Would they be effective? Well, we customized it for him, but they're good guidelines. If someone wanted to give it a shot, why not? So I certainly would give that a shot. Or guess what? You can do a consult with me, thedrbob.com. That's a paid consult, and I'll get the information and dot the I's, cross the T's, and customize a program. I'm looking at the chat. Will this be recorded? Yeah, it will be. And I think we're going to be okay on Zoom. I don't think I gave any information that, interestingly enough, we live in a world where if it appears you're making some type of health claim, and I'm being very generic and I'm sharing PubMed, you get shot down. And so we don't want to make any health claims. And notice what Ron Worley said, can you help me? I don't know, but I'll try. And he kind of laughed. Oh yeah, sure. What are you going to do different? Well, let's take a look. Let's see what happens. 10 days later, off a cardiac transplant list. Pretty powerful change.
Perfect. Can you show the hypertension effects on the heart again?
Can I show it? I don't know that I'm understanding the question, but so here's what I'll tell you. High blood pressure is an absolute total strain on the heart and on the entire cardiovascular system. But here's a new piece of data. And by the way, someone had asked me earlier about visceral adipose tissue. So I'm going to show a picture of a scan that shows visceral adipose tissue. And some of us have a mentor that had, a DEXA scan. And at any rate, they said, well, you've got 3 pounds of visceral adipose tissue. And I was thinking, gosh, that doesn't sound like much at all. But that is not really an accurate description. So when they're talking about visceral adipose tissue, why am I having such a hard time finding that? There it is. What they're talking about is there's something called a DEXA scan. And they take one slice of that scan at a very specific level of the heart, of the spine. Let me open that up again. So now I'm trying to talk and do things at the same time. And Carol usually saves me because she knows I can't multitask.
Not recommended.
I've got that male brain, right? And it works good for what it's supposed to do, but it doesn't do 2 things at once. All right, so now we're going to share screen. Where are we? Share screen. There it is. Share. All right, so are you seeing it or no? A picture is worth a couple million words, so that's where I like to see it. So, all right, what they do is they just take, a different slice right through the abdomen at the level of L4 for people that understand that. And then they look at the area that's taken up by the fat and they do a mathematical calculation, which seems pretty reasonable. So in this first one here, first of all, you're going to see a lot more fat. You see a lot more distorted signal. You see, I don't know what they classically call those things, love handles and stuff like that. But ultimately, they said that this person had 1,676 grams. That's how it's counted, or 3.69 pounds, which is not acceptable. This person apparently pretty lean, 135 grams, basically, about 0.3 pounds. So not much at all, maybe 4 ounces. Oh, there it is. There's the number there, 4.7 ounces. So you start looking at that and you begin to realize that, okay, how much is acceptable? And they're actually saying that a pound or less for a male is acceptable, 0.8 pounds for a female. And now that I did all that, I forgot the question. So what's our question? Hypertension? Okay, there we go. So now, when we get a fat abdomen, most people know about this thing called fatty liver. Well, the liver gets most blood flow at rest, and there's something called the hepatic artery. And so if my liver, let's say this is my liver, and it starts filling up with fat, it compresses the hepatic artery. And there's also renal arteries, and you get what's called kidney fat, intra-kidney fat. So there's your renal artery that goes like this. These are primary filters. So if your body wants to filter your blood, it has to elevate the blood pressure. And for some people, it doesn't take much visceral fat to start compressing the hepatic artery and the renal artery, and it starts stressing the heart. So there's something called the left ventricle, and the left ventricle starts pushing. And then as that muscle grows, it starts to alter the entire heart dynamic, the entire heart structure, the entire wiring of the heart, the electrical system. Now you can have arrhythmias. Now you have an irregular pump. And all these things go awry. And so you don't want high blood pressure. Friends do not let friends become hypertensive. And so what do? Well, we eat right, drink right, think right, move right, sleep right, poop right, talk right every day. Is that going to be a perfect strategy? No, nothing's perfect, but high 90th percentile, that ought to be pretty good. Maybe someone else has something unique that's triggering the high blood pressure. But if you dot the I's and cross the T's in terms of lifestyle, you're probably going to have a healthy life and not have cardiovascular disease or hypertension. But here's what I'll tell you. When people have hypertension, I had someone show up in my office. We're talking about a fairly young female, 50 years old. Hey, I take blood pressure. Her pressure is like 220 over 130. And I said, what the heck's going on? She says, I knew my blood pressure was high. I said, well, that's not high, that's sky high, and you're a disaster waiting to happen. So what I do, I sent her to the emergency room. And well, thank God that her pressure is much, much, much lower. That's a good use of medication. Now, what are we going to do? We're still going to figure out what the heck caused it. Was there likely some visceral adipose tissue? Well, she could lose some weight, that's for sure. Was she under high stress? Absolutely. Was her diet as good as it should be? No. How was her exercise routine? Not very good. And for her, it was the perfect storm for hypertension. I'm just thankful that she showed up in my office that day and we said, and we took the blood pressure, hey, let's do that. We do that as a standard screening on new patients or people we hadn't seen for a while. So pretty good idea there.
Dr. Paul, do you have a question?
Yeah, happy evening, everyone. Just a curious question. Stress EKG. I just read that there's a high number of false positives on this test, and I'd not seen that before. Can you comment on it, Dr. Bob? Are you aware of that?
Well, things are computerized now. They literally have a computer algorithm that'll read it. It's not often a cardiologist. And so here's a story that I'll interestingly share with you. So, one of my more famous patients is Evander Holyfield, but you go back and look at his history, he had a big fight. He threw more punches in the round than he ever did. And they thought, wow, this guy's amazing. And they gave him a workup at the Mayo Clinic. And they said, oh my God, you can't fight ever again. In fact, we don't even recommend you exercise. And oh my gosh, start all these drugs. You have the most profound cardiac arrhythmia, cardiac rhythm that we've ever seen. You're a ticking time bomb. We have some of the same mentors, Dr. Paul, and Dr. Jeff Bland commented on that because, just magically Holyfield was healed. And Holyfield say, well, God gave me a miracle. Well, no, his heart was the same, but he had a different person reading the data. And by the way, God gives all of us a miracle with every breath. So let's not debate that at all. But Jeff Bland would say, you want to read the easiest EKG ever? Here it is. Flatline is super, super easy to read. We can all read it, right? And by the way, we don't need that EKG to tell us the patient's dead. We've got this normal sinus rhythm, but when it's really dynamic, like Holyfield's, it goes like this. And they go, what the heck is that? They've never seen anything like that. But then you see a guy at 217 pounds floating like a butterfly, stinging like a bee, stealing that from his friend Ali. But, fighting and dancing and throwing and doing everything he could with a phenomenal heart. So there's a lot of false positives because if you don't fit the norm, then you're going to have a report that's going to make you look like something's wrong. But when you have a skilled practitioner looking at you, someone who reads EKGs, and that's not me, I'm not an EKG reader at all. Did I learn how to read them? Yeah. Did I have to read them to pass the test? Yeah. Could I do it tomorrow with confidence? Absolutely not. That's what cardiologists are for. So I don't have any doubt about that. But now that there's a lot of things that have gotten more sophisticated, and now they feel that nearly everybody has like a little bit of regurgitation too. So, is it a tricuspid valve problem, a mitral valve problem? Well, if it's a normal thing and we all have a little bit, when do we call it a problem? Well, when it starts causing problems, we call it a problem.
Very good. I understand the gold standard is the coronary artery CT scan, but honestly, I don't see that a lot in my practice.
Oh, I had one done a while ago. I mean, when they first came out, I thought, okay, I've got this huge cardiovascular family risk. I didn't go through my personal risk. My great-grandfather died at 37 of a heart attack. My grandfather died at 49 of a heart attack. My dad had quadruple bypass at 49. When he turned 50, he was the oldest living male in the family tree. By the way, my mother's father was an insulin-dependent diabetic. My mother was diagnosed with rheumatoid arthritis at 29, multiple sclerosis by 35, was supposed to be in a wheelchair by 40, maybe not live to 50. My parents are both 81, and they wake up at 6 o'clock in the morning, 6 days a week and go to the gym. So what was the difference between my dad needing quadruple bypass at 49 and being pretty doggone fit and active at 81? He said, okay, I'm going to quit smoking. I'm going to eat right, drink right, think right, move right, sleep right, poop right, talk right. And my mom had some miracle remissions. So I thought, well, I got a cardiovascular risk genetically. What was my score? Perfect score. Why? Because I take pretty good care of myself. So my genes, hey, I've got perfect genes, and so do you, and so does everybody I see on here, if we take care of what we've been given.
They say, Dr. Bob, there's no such thing as a sudden heart attack. It takes years of preparation. So, and I like your motto, it's easier to stay out of trouble than getting out of trouble. So,
yeah, well, I'm going to go with you on that, but keep in mind, there could be a drug-induced heart attack that could do it, right? And, we don't wish that on anybody, but, that's been done. I'm thinking, was it Len Bias that, was it a cardiac failure? He was the number 2 overall pick in the NBA draft by the Boston Celtics. He had a cocaine binge, and I believed he had a heart attack. So, yeah, I should Google that real quick, just because I like to be accurate in what I'm saying. But yeah, under no normal circumstances would that happen. Share screen real quick. So, Dr. Paul, I'm not sure that you're an NBA fan. He wasn't an NHL guy, but so here's that data right there. Celtics draftee Len Bias dies of a heart attack. Came out of perfect physical 2 days earlier. 22 years old. And so,
wow.
Then we could look up the other thing I just said. And by the way, I should really verify that, because that's what I had heard from people that know. Len Bias.
Yeah, cocaine overdose in the black letter.
Yeah.
Right at the very top.
Yeah. There you go. So sad, right? But some people we can share as a shining example, and some people are warnings, and that was a warning.
Thank you.
You're welcome.
Okay. Anyone else? You might have a quiet evening.
Well, it's already 6:50. I was probably long-winded, longer than typical.
Okay. Time to thank the man.
Thank you.
Do the heart thing today.
Thank you, Dr. Bob.
You're awesome.
Thank you all. Good
Thank
night,
you, Carol.
and God bless.